Experts in the malaria response are urging for a shift in the treatment of malaria through the use of only Artemisinin-Based combination therapies, which are the recommended treatments for uncomplicated malaria cases globally. They insist the use of monotherapies is prohibited by law and not the treatment or cure for the disease. TVC News' Kemi Balogun reports.
Malaria remains a major public health concern in Nigeria. It has the highest burden globally, with the risk of transmission existing throughout the country. Globally, malaria accounts for 249 million cases annually, with an estimated annual death rate of 608,000. In 2023, Nigeria recorded 27% of the global cases and 31% of all deaths. These experts at this second edition media chat organized by the National Malaria Elimination Program are highlighting that once a malaria test is positive, treatment should be only done by ACTs, as the continued use of monotherapies cause severe consequences.
Most of the countries that have eliminated malaria, they do not use medicine, but they eliminated malaria by environmental sanitation through advocacy, communication, and social mobilization.
In country, the recommended treatment for malaria is the use of ACTs, and that is Artemisinin-Based combination therapy. That is what we use for testing for treatment of malaria in Nigeria. And as we all know, in country, there are different parasites. When you call the Plasmodium falciparum is what we have, it's higher in the country. So that is what is more common. And ACTs are able to completely eliminate the parasites from the blood system.
They believe that with an effective case management intervention through prompt diagnosis and treatment with recommended antimalarial, a reduction of malaria burden is in sight.
The approach to malaria control is not a one-glove-fits-all. No, it's a combined approach. It's always important that we test every fever case that comes to the hospital. Okay? It's very, very important we test, just so that we're able to accurately or treat the disease, confirm it, and then treat it appropriately.
Despite the progress made in the control of malaria burden, which has moved from 42% in 2010 to 22% in 2022, more still needs to be done to ensure that Nigeria meets the target of eliminating malaria by the year 2030. Kemi Balogun, TVC News, Abuja.